A few brief words, but without notes, I'm going to begin and end with mahalos to you, Marc, to you and Lynn, for your generosity. You are what got us to our dreams. And we've had these dreams for a very long time. And I'm going to share some of the stories similar to Jerry, so you can see how that evolved. But everyone, we have known for decades that we had need on the neighbor islands, but specifically in Hilo, where we have a large population of people in need. When I came to Hawaii in 2000, I got my medical license on August 18th. They said, you're gonna work in the big city of Hilo, when I came over from Pennsylvania. And then when I landed, they said, actually, we're gonna have you work in this other wonderful place called Ka'u. It's 60 miles south of the big city of Hilo, which is what I did for many years. But in those first weeks and months, we were so short on physicians, they would have me drive up, stay over at the local hotel, and cover the hospital for 7-day shifts. So my earliest coverage of a hospital after getting out of residency was right here behind us, was at Hilo Hospital, and I was given that gift to meet the people of Hilo. Little did I know, my in-laws were coming in and out, my future in-laws were coming in and out of the hospital for care, my Auntie Dell and my Auntie Lisa, because this is their home hospital. I didn't meet Jamie till 5 years later. So I had that experience seeing the care at this wonderful hospital, but we always had limitations, and the limitations are clear. To have a young resident just coming into state and having that be their first assignment without extra experience, without extra backing, that tells you really how short we are with all the services that we need. So here we are now 20 years later, 25 years later, and as you know, we still have this challenge of being underserved in our rural areas, but not for much longer. We've seen people struggle to get resources. We've fought year after year after year to get what we can, to especially the neighbor islands, because we have this sense that there are, some subtle differences between Oahu and the neighbor island community as far as healthcare needs go. Historically, we have about a 22% shortage of healthcare providers statewide, but we have a 40% shortage of providers, of doctors and nurses and social workers and psychologists and everyone here on Big Island, on Maui, on Kauai, on Molokai. So it's absolutely necessary. And so we began to have these dreams that we could somehow find the resource. But no matter how generous, and we got lots of appropriations over the years, but no matter how generous they were, they could never really catch up. So as you know, if there wasn't a priority that was healthcare, would be totally insane from me as a doctor who got to work these years with Jerry in the real rural places, in Ka'u, in Kohala, where again, services are modest. And often we have to transfer people here to Hilo, sometimes to Kona, but really to the larger facility here if someone has a serious need. And Marc, I know, is sharing some of those stories. And if we don't have them here, then people will have to try within the golden hour to get to Oahu. But that golden hour, as we know, is not 1 hour. It's often 5 or 6 or 8 hours. I was on call that night in the emergency department in Kohala when the plane crashed in Maui, taking the lives of 3 people and limiting what we could do as a county at that moment, transferring patients. And does that not sound eerily familiar? Because 2 days into our governorship, we had a crash again, now 22 years later, and that essentially grounded our air transport for 2 months. So just for perspective, we have had that exact challenge for over 2 decades. But now here we are today. The word came in during COVID from Dan. We have a plan. We can provide a lot of care, but we need to do a lot more here and we have to expand. And so he laid out the plans for me and said, we've got about $100 million project here that someday we ought to be able to do. And then miraculously, the election occurs and we hear that this gentleman, Marc Benioff, is willing to help. So I said, Dan, I know that you wanted to do some incremental things because we have such need, but there's this guy who said he will match whatever we do. Don't just ask for $20 million, please. Sorry, Mark. So we all put our thinking caps on, and we humbly asked. We said, "Do you think, LG, can you talk to some of our guys? You've been running that committee for a long time. Can you convince the people on Oahu, the senators? We know our local leadership is going to fight for it, but we have an opportunity of a lifetime because Marc has been so generous to start caring for all the people of Big Island. Can we find a way?" And then quietly, so it wasn't a terrible, mean surprise, said, "Marc, they do have a $100 million project that could really help the people of Big Island. Would it be okay? Would it be okay if we appropriated $50 million and you came in with 50?" He said, "Fine, no problem. If it's going to help people, we're doing it." That conversation lasted less than 10 seconds in order to take care of the people of Big Island. And so what people should know is this gift and this commitment from the leadership across the state means that people, when they need intensive care treatment, will not have to seek a transport when that golden hour might be many hours and too long to care for those that we love. That care will be right here, either just over the mountain or just around the corner. And just to add one more incredible gesture, even though the Benioff team family had decided that they were going to do this large project, we came to them one more time and we said, we also have this shortage of healthcare providers. A hospital is only as good as the nurses and the intensivists, all the doctors, the psychiatrists. It's only as good as the capacity of the people in it. And we have wonderful people, Marc, but we'd like to attract more. We have a plan to forgive the loans of anyone who applies, but we have twice as many applications on Big Island as we have monies to generously accommodate that loan forgiveness. And he doubled down and gave us an additional $5 million. So I'll conclude by saying, as this beautiful building rises from the ground and we say the prayer and we celebrate the ability to deliver all care here on Big Island, it will not just be the building and the technology that was supported by this magnificent Benioff Foundation and the leadership here in the state, but also those providers that will be in there that we will attract from other states, not nearly as extraordinary as Hawaii. As those providers find a new home, they'll find it here because we can forgive their loans to put them in the beautiful Hilo Benioff Medical Center. Aloha and thank you, Marc.
Aloha, everyone. Aloha. And Elena, thank you for that wonderful introduction. And Governor, thank you for your inspiring words, your aloha. And thank you also for your leadership, all the way from this emergency room to the State House. So thank you for everything that you do every day. And to Senator Noe also, and Representative Nakashima, and Mayor Roth, and to all of our elected officials here, mahalo to you for your service to all of us here. We're so grateful to you. And to you as well, Jerry. Thank you. It's so wonderful to see you again, and thank you for your great service to this community. And thank you for your dedication, all of you, to the people of Hawaii. Mahalo also to all of our EMTs who are here, to our nurses, our doctors, our physicians, our specialists, our staff, the folks who are doing the Lord's work every single day here at this hospital. We know who you are. You get up every day, you give everything you have to give people the most precious gift they have, which is their health. And we've all seen that play out every moment. And thank you for everything you're doing in your hearts for all the patients and for all of our neighbors here and the whole community of this island. And mahalo to every single one of you for being here today and for everything that you're doing for our island and supporting this important project. And what a beautiful Hilo day it is, very typical. What a fun, wonderful ceremony, and it's great to be here. It's a powerful reminder of what we do when we come together as a community. Lynn, Lynn and I are profoundly grateful to be part of this community. And, you know, I first came to Hawaii about 50 years ago to this island. And of course, I also fell in love with it. And I fell in love with all of you, especially the people of this island, which is what makes it so special, our ohana. I fell in love with the land, the aina. I fell in love with the spirit, the aloha spirit. And Lynn and I have lived very quietly on the Big Island for a long time. We have no commercial presence here. We're here because this island is our home, and this is where we've chosen to raise our family. We have made wonderful friends here along the way, many of whom are here under this tent, beautiful tent with us today, and we're so grateful to see so many of you with us. Now, we also know this island, and living here, we know that this island, it can have challenges, yeah? And one of the biggest is healthcare. We all know that, because when it goes wrong, it can go really wrong. And we know that together, we all need to do more to improve access to this quality healthcare for everyone who lives on this island. But we know we need more infrastructure, more nurses, more doctors, more specialized care in areas especially like neurology and oncology. And we know that we need it for people who have needed that care at that critical moment. And one I'd like to just recognize today, who I'm so grateful who's here, Danny Akaka. So Danny's. And I'm so happy that Danny and Anna Cocker are here to join us today. And as many of you know, last October at the Hawaiian Island Healthcare Summit, I know many of you who are here were there at the Hapuna Beach Hotel. Right when he was on stage, Danny had a health scare. He had a stroke. And fortunately, many of the folks who are here, the EMTs and the doctors and the nurses, everyone went into action, and Danny got immediate attention, and he needed even more. Lynn and I were there with him in the emergency room for about 7 hours and trying to get him to that neuro ICU on Oahu. And all of us know what that is like. We've all been through this exercise, haven't we? And I was on the phone with the governor, I'm on the phone with many people who are here, and how challenging it was. We did not yet have this new state-of-the-art medical kind of ambulance helicopter that's going to soon be on the island, procured by our friends the Sayers. We didn't have the infrastructure, but we did get Danny to Oahu. We were so happy to get him to the neuro ICU. We were so happy then to get him to UCSF Health, where he's been for the last several months under their neurocare, and it's a miracle that you're here, and we're so happy to have you here, Danny. And we thank God for that beautiful blessing that we see right now, and we're also happy and grateful that you're doing so well. You're here with us on the road to a full recovery, but listen, here's the truth. We need more of that wonderful care right here, exactly like Jerry was said, for Danny right here on the Big Island and in Hawaii, that can happen in that critical moment. And everyone on our island deserves to get the care they need when they need it at that moment. And that's why today is so exciting, because it's a new beginning for healthcare on the island. Now, it's not just because we're adding an incredible new building. It's not the building, as everyone in this tent knows. It's the ohana. It's the people. That is what makes this come together and why it's so special. And this includes our extended ohana. Yes, we're on our neighbor island here, our beautiful Big Island. We love it here. And we know that sometimes we need to have our phone calls returned from Oahu. Dan has told me that's a critical thing, and that's why I'm so grateful also for our relationship with the folks from Straub who are here that are going to link so tightly now with our hospital. And also a great new partnership with UCSF in San Francisco, which is a major medical and research center, and to link this trinity together so that we can have an extended family and an extended hana of care. Very exciting. It's also why I'm so excited about the work that Frank and Laura are doing with the SARE Foundation. And thanks to their incredible work and the partnership of people across this island, we're expanding our ability to respond to crisis situations, from fires, which we've had, to health emergencies. We have one brand new medical helicopter, a beautiful Airbus 125, and we have another more advanced one, a 145, coming next year. That's very exciting, on order. And 4 brand new beautiful trucks, in addition to the dozen brand new fire trucks that they've already procured for us. And we're going to bless those later today at the fire station here in Hilo. Lauren, Frank, thank you so much for everything you're doing for the island. We're so grateful to you. It takes many, many folks and many resources, as we all know, because the people who are here today know what that's like, that to get everyone the care they need as fast as possible, and we have to do a lot more. In the 50 years that I've been coming here and living here, and I have to tell you, I've never seen a project exactly this kind. And it's not that I haven't seen $100 million projects here on the Big Island, because I have, but usually they're hotels or they're telescopes or they're other commercial activities, but this is unique. And I think for all of us who are thinking about this, are thinking, yeah, this is a $100 million groundbreaking for a major expansion of this critical hospital to serve the people of this island. So I've never seen anything like it. It's an unprecedented investment in our local community that we so badly need. We're expanding the safety net. This is where we're going to save our parents' lives, our kapuna. This is where our children will be born and continue to be born. And I'm confident we're going to get it done. And I just want to recognize the incredible leadership of Dan Brinkman and everything you've done, Dan, to make this happen. It has been a joy, because you can be a philanthropist and you want to do medical philanthropy and build a hospital, and Lynn and I have done that a couple times already, but if we don't have a willing partner and an operator, it does not happen. So Lynn and I began working on this project now with Dan and his team in Hilo more than a year ago. They keep showing us how to get things done. We like that. Done in a hurry, like that too. And with the investment to get it right. And this work is saving lives. And as we break this ground today, I'm excited to see that all the dedication and the hard work from this incredible team that Dan is leading coming to fruition. And I can only imagine what it's going to be like when we're all back together 5 years from now and open the doors of this amazing new building. So in closing, I just want to say again, with my family and my Ohana, and I'm so proud to be part of all of your Ohana, and we join together as one Ohana on this island, which is the most important thing, because we know that in healthcare, we have to be one Ohana. That's how we save lives, and that's how we make things come together, working together. And listen, we're on a little island in the middle of the Pacific Ocean. We all realize that. We cannot afford to be divided by factions or barriers or boundaries or any kind of separation of any kind. We have to unify and come together and integrate and be together as one team. And that's how we're going to solve our challenges that we have on our island and our state too, Governor. And if we work together as one Ohana, well, I know we can. Well, anyway, thank you very much, everyone. Mahalo.
Before I say a few things, I just want to acknowledge our admin staff. What a great ceremony they put on today. Absolutely. This, nothing good happens by itself. So this is a good example. And if I'm Elena, she's going to tell me, hold the mic closer to your mouth, right? So one of the problems with following great storytellers and distinguished speakers and folks who talk and inspire people is that it's really hard to come up with something good to say that hadn't already been said, okay? But the advantage of it is that going last is that you get the last word. I'm okay with that. So I'll tell you a little story. It involves also Elena. About 8 years ago, we were in the first floor of that building, an old admin. We were sitting in an office and we were trying to be clever. And we wanted to come up with a slogan, a phrase, something that represented what we all do here. I mean, we were honestly getting a little frustrated because we have such a diverse workforce. People are very opinionated. And at the time, I think honestly, we weren't all on the same page, and we were looking for what binds us all together. And we weren't getting anywhere. And then I remember us talking, and it's like, well, what do we all have in common? It was really simple but profound, is that we are all family, friends, and neighbors. I mean, if you live on an island, literally our people that work here, we all are so tied together. If you're in East Hawaii or Hawaii Island, in our small state, you both figuratively and often literally are caring for each other. And that's just amazing. And so I've had the privilege to represent all my family, friends, and neighbors that work in that hospital, that care for all of you. And we collectively thank our governor, our senators, our representatives for your wisdom and your support to get us here. The wise men and women of our East Hawaii Regional Board for your leadership and your vision. You've been so supportive. For me, my executive team that I work with, my colleagues, my fellow nurses, and my friend and good physician, Dr. Kanas, the hard work we do every day, often it doesn't get noticed, and it matters. And not last, and amazingly, we all collectively want to thank the amazing generosity of Marc and Lynn. You're kind of like a unicorn, dude. You really are. And it's really great. Yeah. And so we're here today for a groundbreaking, for a great, beautiful new place. I know it will be beautiful, where we can provide the best possible care for our family, our friends, and our neighbors. How fortunate are we to have that as our mission, to care for each other, right? So mahalo, aloha, let's get our pictures taken. After that.